The Gauteng MEC of Health, Dr. Ramokgopa, is briefing the media about the transfer of mental patients to properly licensed facilities from NGOs as per Health Ombudsman's recommendation. Let's go live to that story.
Facilitating the Mental Health Directorate in the department while refocusing the organization. The first relocations, if I have to remind all of us, began on the 3rd of March 2017. We're pleased to say that all patients, except where there are disputes or misunderstandings, have been relocated. Thus, over 91% of eligible patients have been removed and relocated from NGOs to date. I will deal with the issue of the disputes and misunderstandings, where we felt at that point in time it was not in the best interest of the patient to deepen the disputes, and we have set up different processes to deal with that. As of the 26th of April 2017, 750 patients were transferred to 3 facilities, namely clinics, Selby Park, 390 transferred there, Baneng, 232 transferred there, and Waverley Care Center, where 128 were transferred there. Of these patients, 63 are not part of the live Esidimeni cohort. Those were patients that we found in these NGOs that we felt it was also in their best interest that they are also removed from these NGOs that were not appropriate. It should be noted that some patients remain due to various matters such as acute care and not suitable for discharge in the various hospitals as such. The patients who were in the NGOs and referred to the various hospitals, they will not be sent back to these NGOs, but when they get better, they will be sent directly to these facilities. I must also share with the public that in some of the instances, the following NGOs have even taken legal steps to stop us from moving the patients. Others, the patient families have signed refusal letters, and in 2 cases, the patients themselves refused to be moved. And these affected NGOs are Anani Home, where there are 12, Dolphin Acre, where there are 2, Little Eden Home, where there's 1, Moseho, 14, Hebshiba, 11, Udirile, 6, St. Michael, 4, Bokang, 2, Mudimu, 15. We have instituted also legal steps in the relevant areas, and will be working with the Mental Health Review Board to intervene decisively, as we've indicated, in the best interest of patients. With regard to these numbers would have been higher, but some of the interventions we made was to take the parents that had refused transfer to Selby Park and Baneng initially, and many of the patients changed their minds, or of the patients' families changed their minds after seeing the relocated, other patients who were relocated, the new facilities. So from our point of view, whilst we will be looking at legal interventions and taking steps to even overrule the families where patient interest is of paramount importance, we believe that other dispute resolution mechanisms can help. And we'll continue taking families that had refused transfer to these facilities like Selby Park, Waverley, and Baneng, so that they can satisfy themselves that these are indeed better facilities. And we are convinced that through that process, more of these families will come to agree with us for the removals. With regard to mental patients currently housed in general and psychiatric hospitals, 378 are in long-term beds, in Vescopis, Sterkfontein, amongst others, and 50 are in acute care beds, meaning that they have one other illness or the other. Since the release of the Ombud report, 5 patients have unfortunately died, and in spite of the fact that the causes of death were cited as natural causes, we have instructed that post-mortems be conducted, and we are awaiting the outcome thereof. We believe that one death is one death too many. We're also happy to report that we have closed about 20 NGOs which used to house mental patients. These include Bophelong, Mashimong, House of El Shaddai, Kanana, Lapeng, Maboredi, Rebafenyu 3, Sebo Sarina 1, Sebo Sarina 2, Siabadinga, Siabatanda, Solutions Care Center, Takalani, Tuli Home, Mbali, Tuli Home, Zanele, Tsepong, and Tumelo Home. Ubuhlebenkosi, 2 facilities under an NGO called Precious Angels, one in Atteridgeville and the other one in Denville, Pretoria West. 2 NGOs operating in the Cullinan Care and Rehabilitation Center, which were called Enka and Siabadinga, are also closed. And 2 facilities under the NGOs called Ribafeni in Erasmia and Pelendaba. On disciplinary processes, the disciplinary hearing for the HOD and the Director for Mental Health Directorate have been postponed until the completion of the appeals tribunal process currently underway. This means that the 2 appealed against the report of the health ombuds, and the appeals tribunal, chaired by retired Judge Ngwepe, is underway to consider their appeals. Regarding the other officials of the department that were cited in the report, the disciplinary processes are underway as we conclude the investigations. A private attorney has been appointed as to do the investigations and to prosecute and to lead evidence, whilst an advocate has been appointed as a presiding officer. I wish to convey my sincerest gratitude to the project team that was chaired jointly by the directors of the National Department of Health, Ms. Precious Matsoso, the Director General of the Gauteng Provincial Government, Ms. Pindile Baleni, as well as the acting HOD of the Gauteng Department of Health, Dr. Ernest Kinoshi. The team reported regularly on the work that was done by the project management committee, which was led by Dr. Kerrigan McCarthy. They reported regularly to myself as the MEC for Health, the Premier, and the Minister. We are humbled by the unwavering support and oversight and guidance of the Family Committee, who have been working closely with the team throughout this process. We also want to thank the media for helping us to keep the public informed, as this is an important matter of public interest. A reconstituted team chaired by Dr. Eddie Park, who is a distinguished psychiatrist, is continuing to do the work with the department on the relocation of the patients where we have cited that there were disputes and or misunderstandings. Our work as a department will not stop when the implementation of the Health Ombuds recommendations come to an end. We're focusing on strengthening relationship with various stakeholders and civil society organizations that are critical for health service delivery. As I've announced before, I've already begun visiting and meeting with clinic committees, and already we have met clinic committees in the West Rand and in Ekurhuleni. We'll be completing our meetings with the clinic committees in the other 3 districts over this coming week. We've already met as well with the hospital boards of our province, and we have also indicated to them the importance of community oversight and also strengthening governance structures. I've also announced that we have reconstituted the Mental Health Review Board from 1 provincial board to 5 boards, and Dr. Motlana, who is also a distinguished psychiatrist, is helping together with her committee, are helping us to finalize the reconstitution of this process and the induction of the new mental health review boards for the province. This will be done before the end of this month. The department will continue to focus on strengthening the performance management framework for all mental health care services in the province, including the strategy that will ensure continuous advocacy on promotion of mental health, because indeed our province and the country has a huge burden of mental illnesses. And we would like, in as much as we strengthen the quality of services that we provide on one hand, we should to prevent mental illnesses. On the 11th of this month, we will be making a presentation to the Provincial Health Forum, which is a statutory forum of stakeholders in the health sector. And we have agreed that we will also give a progress report to this forum. Together with the Premier and the Minister, we will also be giving a formal progress report to the Health Ombuds, although as the department we have also gave him informal progress report and briefings on the work we have done. Ladies and gentlemen, I would also like to inform the public that the department is busy as we speak, as of the 2nd of May until the 26th of May, with a campaign against measles. This immunization campaign is a response to measles outbreak that has seen 11 cases that are confirmed by laboratory so far. As we are aware, every 3 to 4 years, there's a need to have a national campaign against measles. This national campaign is due to begin in the month of June. But as Gauteng, we have decided to start earlier because of this outbreak. The reason for national campaigns every 3 to 4 years is because there is a gradual build-up of susceptibility to measles disease. The measles vaccine can guarantee around 95% immunity to the population. So the regular national campaigns are to make sure that those 5% population is also we reduce the risk from the 5% that are susceptible. That is why there's a need to have a nationwide campaign that would vaccinate all children against the disease. We have commenced a 24 days province-wide measles immunization campaign in response to the current outbreak. We aim to vaccinate around 1 million children between the ages of 6 months and 5 years across the province. And since the Johannesburg region is the center of the epidemic, we are extending the target group in this region to be vaccinated up to 15 years. The June month, which would be a usual national campaign, for Gauteng will be used as a mop-up period. Immunization centers have been set up in all public health facilities. These include clinics, community health centers, and hospitals. A parental consent will be required for a child to be vaccinated in creches and in our schools. About 17 cases have been confirmed so far, 3 in Tshwane, 1 in Ekurhuleni, and 13 in Johannesburg region. We are working with our epidemiological and surveillance team, supported by national, to make sure that we trace all these cases to be able to contain all the contacts and the outbreak itself. I would like to thank you for your indulgence and also invite the media to partner with us as we journey between now and the 26th of May in this campaign. I thank you.